It's a Wednesday morning, and of course, kind enough to join us on most Wednesdays. My very good friend, he's been part of this morning show for around 30 years, and that's Dr. Joe Congini from Sports Medicine Center, Akron Children's Hospital. Dr. Joe, good morning. What do you have on your schedule for us today?
Hey, Ray, good morning. You know from being around the passion of Cleveland fans and Cleveland sports fans, they also are knowledgeable, too. Our fans are very knowledgeable Cleveland fans, and most of them know who Travis Bazzana is. Mm-hmm. That would be a name that in a lot of places, gosh, who in the heck is Travis Bazzana? But our fans know he's the phenom from last year, the number one pick overall. It isn't something that we've gotten a lot in baseball, and really, really highly regarded young baseball player, second baseman, overall phenom. A lot of people, as he was starting with us here in Akron with the Rubber Ducks, were looking at some progress through the year and the possibility that he could come out later in the year and really help the Guardians. And so this phenom, and the other thing we know is that we paid him a lot of money as the number one draft pick. He was paid around $9 million in baseball terms, a lot of money as the number one draft pick. Was in the top 10 prospects in baseball, our Cleveland franchise number one prospect. And then all of a sudden we looked out the window over at Canal Park. We didn't see him playing anymore in the last couple of weeks. And so on May 14th, he had the abdominal strain that nowadays in sports, especially in the higher level athletes, we call the oblique strain. And it's one that I've typically stayed away from. It's a little hard to explain to athletes. We see it in our high school and college athletes some, but I wanted to delve into it just a little today. So the oblique strain, if it's a bad strain, it could even have some tearing of that oblique muscle. I read several articles on him. He's out for 8 to 12 weeks, 2 to 3 months. So his must have been a pretty significant strain, maybe even some tearing of fibers, as I read through several articles on him. The definitive is getting an MRI. And with all of our high school kids, and if we run into this issue, we don't always go to an MRI. We often will make a clinical diagnosis in some of the ones that aren't as significant. But his must be pretty significant to be out for that long of a period. And being out that long of a period, we probably won't see him with the Guardians later in the season. We're going to have to really get this young phenom healthy. And of the way this oblique injury, it's the flank muscle, the way that it works is one of the most important sports muscles, I think maybe one of the most important sports muscles we have. And the way I was talking to our PTs yesterday when they are physical therapists in sports, they kind of call it the pop can effect when they talk about the core. So there's 5 really important muscles that work together in the core. And if you pop the top on a pop can, it goes from being pretty solid and stable to pretty weak. And that's what happens. Just one of these 5 muscles can make you weak, and the obliques are definitely the most important. The obliques, again, are the flank muscles on the side. The rectus is the one in the middle, the sit-up muscle that we do with sit-ups. The lumbar, of course, are our back muscles. The diaphragm is the upper part of this core of muscles of the pop can. It is below the lungs. And then the pelvic floor. We hear of pelvic floor injuries sometimes. That's kind of the bottom part, the lower part of this group of 5 muscles. And so, like I said, a lot of times it's the clinical diagnosis. Ultrasound helps us these days. I talked to my partner, Dr. Eddy, who's doing a great job over at the University of Akron. He uses his ultrasound machine to see if there's swelling and get the sense whether there could be some tearing in that muscle. And then if we really need to know a definitive diagnosis, as you would in somebody like a Travis Bazzana, you get an MRI. The big question that you would ask as a Cleveland fan is, hey, what's the long-term prognosis? Could this have an effect on the long-term prognosis? Most of what I've read and seen with this is no, it doesn't have a long-term prognosis overall. And in fact, I guess the hopeful side of me is that by him really addressing this for several months with good physical therapy, that maybe it would even turn out to be something where he stays healthy for the remainder of his career. So that's the hopeful part in me as a Cleveland fan. So one more thing I wanted to mention that's really important. If you're with younger athletes, high school, early high school, junior high especially, you have to think of bone injuries. It can definitely be in the iliac crest, a stress fracture or a growth plate fracture, stress fracture, or a rib fracture. Even in some of our college and pro athletes, when they look a little closer with an MRI, they see rib fractures. Rib stress fractures do occur, and this pain that people are getting in the flank can actually be a rib. So you want to make sure to rule that out. It's a different type of treatment. So the physical therapists really go about balancing these 5 muscles, and these 5 core muscles have to work in concert, we call it. They have to work together. And if they get out of balance, these high-level athletes will have a problem. So we have to hope for our phenom down there. He's in Canton. He's in Akron-Canton right now. He's at our place with the Rubber Ducks, and he's rehabbing really hard. And we really have to hope that rehab goes well and that he reaches his full potential as a really highly regarded baseball player.
Joe, I have to ask you this question a little bit in regards to this injury. It seems like we've had a growth in this type of injury in the last decade plus. And I'm just wondering if that has anything to do with overuse and use of these kids coming up, playing baseball 12 months a year with that same swing or that same throw, really taking its toll on those muscles in that area. Where in past years and decades before, maybe you played a different sport or you didn't throw and swing 12 months a year. Is there something connected, that type of injury, with maybe overuse 12 months a year with these youngsters?
Yeah, this is definitely connected. So thank you for bringing that up. I'd say really 3 things that answer exactly really what you asked. Is overuse without question year-round. Number 2 is kids are more tuned into really working hard on the core, and they will overwork, and then they'll get the core out of balance, and then we'll get into the problem with the injury. And the third part is just the name oblique injury. The obliques are so important in the flank. We used to just call these abdominal injuries in the old days. We didn't have and didn't use the MRI nearly as frequently. Now you actually can see these injuries and get a definitive diagnosis. So the word oblique injury is being used a lot more. But I'd say of those 3 things, you hit the nail totally on the head again, is that these kids working year-round on these muscles and then particularly working on their swing, working on the throw, they're going to get into oblique muscle injuries. And so for all of our spring sport kids, as they head down to state in the next few weeks, and finish up their seasons, and our baseball kids, good luck with everybody who's going down to finish up their seasons, and for some of them finishing up their careers. And let's keep an eye out for oblique injuries, and let's get some good fortune here with it. Travis Bazzana goes on to be the kind of athlete we thought we were getting last year when we signed him.
And, of course, Joe, we have the state softball finals in Akron next weekend, and then the weekend after that, the state baseball finals. So it all culminates right here in Akron.
Yeah, I spoke with the OHSAA yesterday in some great detail about a couple of other factors for a show that I'm going to do in a couple of weeks as some ground was planted at the OHSAA Joint Advisory Committee. And they're looking very forward. They say that of the cities they go to in baseball at Canal Park and in softball at Firestone Stadium, they get about as good a reception, and they love coming to Akron, Ohio. And we want them to keep coming to Akron, Ohio.
We most certainly do. Joe, you mentioned our Akron Rubber Ducks. You're a person that would appreciate this. I dug up some of the best minor league baseball nicknames out there. Besides our Rubber Ducks, how about these names for you? The Lehigh Valley Iron Pigs, the Wichita Wind Surge, the Amarillo Sod Poodles,
oh, no.
the Rocky City, this is Alabama, the Rocky City Trash Pandas, the Fort Wayne Tin Caps, the Beloit Sky Carp, the Cedar Rapids Kernels, K-E-R, like corn kernels,
yeah,
the Tri-City Dust Devils, and the Fort Myers, Florida Mighty Muscles are some of the names that stand out.
next thing, Ray, I want to see the mascots for some of these teams. Where do they come up with the mascots on these teams? But those names are great. Minor league baseball is supposed to be fun, and it's fun to look out our windows of our building and our center and see when the stadium is filled with kids who are enjoying baseball.
I agree. Ken Babby's name change to the Rubber Ducks was certainly genius, to say the least. Joe, as always, my friend, thank you so much. Always appreciate the time with us here in the morning show. Thank you again.
Have a great rest of the week, Ray. Thanks.
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, joins us most Wednesday mornings